After you've had surgery, lumpectomy or mastectomy, and you've gone back to see your surgeon, you will get a full pathology report. And almost at the end of the myriad pages that will go into very descriptive detail, you will see 3 things that we look for in the pathology that really help us to design treatment. And that is the estrogen and progesterone receptors, whether they're positive or negative, and something called HER2/neu. So I sort of date myself by using this analogy, but do you remember the old TVs that had bunny ears on them? Well, if your tumor has bunny ears, we would call that an estrogen or progesterone receptor positive tumor. If it doesn't have bunny ears, it's estrogen or progesterone receptor negative. And why is this important? If it's positive, that's more of a good thing, actually, in some ways. It means that the tumor is fed by female hormones. Your tumor likes estrogen. If it is estrogen or progesterone negative, it's not affected by hormones. So if we go to treat someone with an estrogen positive tumor, one of the ways we could treat them orally is with a medication that will block or decrease estrogen production. And so that treatment is for women who are estrogen receptor positive. If you're estrogen receptor negative, they will not work for you. That's simply what it means. The other part that we look at, the third part, is something called HER2/neu. And this is an overabundance of a certain protein on the cell that we think makes certain tumors likely more aggressive. The great news is that there's a treatment for it that we call Herceptin. In fact, there was a movie made a number of years with Harry Connick Jr. playing the role of the doctor who discovered this antibody, or this protein. And at that time, women didn't do as well. He discovered it, and he discovered the treatment that we call Herceptin, or it's also called trastuzumab, and that's given intravenously every 3 weeks for a year. So it's not a chemo treatment. So women who require Herceptin don't lose their hair. They can work and function quite normally. They may have some shortness of breath. That is a side effect. So that's just for you to understand at the very last page whether you are estrogen receptor positive or negative, progesterone receptor positive or negative, or HER2 positive or negative, just to help you understand a bit further.